Hello, I'm one of the GP trainees training in Birmingham, Solihull. I just wanted to make a quick video talking to you about how I think about problems the patients come to me with, how I ask questions, and how I manage the problems. So for this, I use a technique that I have come up with myself. It's called the trifecta. It basically involves one, exploring their problem, finding about complications if they have any, talking about the cause, trying to figure out what the cause is, and finally thinking about their thoughts, which gets involved in ICE. The way I do it is one, problem, cause of the problem, right? So my questioning basically involves asking more about these things, the problem and then cause of the problem. The first is the problem, right? So this basically involves asking open questions such as tell me more about it, and you can ask these open questions for any problem that a patient comes with. So this is very reproducible. Tell me more about it. How did it start? What makes it better or worse? How bad is it now? What are your thoughts about it? How is it impacting your life? How are you coping with it? What have you tried for it so far? So this gives you a general idea about the problem. Of course, you can ask more specific questions about it if you want as well. Like for example, if they haven't mentioned which exact site they have that complaint in, so that would come more in this, tell me more about it. So you can just fill that up with some close questions. So once that is done, then I try and explore other things that they're missing, and that comes in what else. In this, I ask about any adjacent complaints. Like for example, if they complain of tummy aches, then I ask about what about diarrhea? What about vomiting? So that comes in adjacent complaints, usually in the same system. And then I ask about complications. For example, if you have someone coming with diarrhea, then one of the complications of diarrhea is dehydration. You don't need any medical knowledge for that. So ask about things that explore dehydration, tiredness, that sort of thing. If someone comes to you with menorrhagia, you can also ask about fatigue, tiredness, breathlessness, that sort of complaints. So that gets covered in complications. All right, now let's come to the second aspect, trying to figure out the cause. I use a technique that I call as layered thinking in order to do this. Basically, I go through various different categories of possible causes to try and figure out what's actually causing the problem for the patient. The first thing that I do is ask about red flags. And for most complaints, this includes systemic complaints like fever and complaints related to cancer, such as weight loss. And then I ask about common sense questions. Find more about, we'll learn more about this soon enough when I give an example. Then this is where you need most of your medical knowledge for medical causes. So think about broad conditions, medicine, surgery, psychiatry, obstetric, and gynecology to try and figure out conditions that might possibly explain the cause for the complaint. Then we'll talk about medications. Think about all the medications that might cause the problem. And one way in which I also explore other medications that they take is I try and ask about one of the medications that might cause the problem, then ask what are the medications do you take. So that's one way I can explore both the cause of the medications and just also generally get a detail about all the medications they're already taking. Then ask about allergies and social history. This involves things like smoking, alcohol consumption, other IV drug abuses, anything that might possibly explain the cause for their complaint. And then family history. Sometimes this relates to the risk factors of certain conditions, and can also involve other things like, for example, exposure to smoke from family, that sort of thing. Now let's just go through an example of a condition. Let's take into consideration a patient who has come with low hemoglobin, and we're trying to find out why they have low hemoglobin and work through this example. Let's talk about red flags first. So, red flags related to cancer, such as weight loss. Then you can have other complaints, such as systemic complaints, such as long-standing fever that can indicate anemia of chronic disease. Then you think about common sense things. Why might someone have anemia? Um, Talk about the diet. See if they're deficient in iron in the diet, or that if they're deficient in B12, folate. Just think about what sort of diet they're having. So that would come under common sense. Now, in medical causes, you have so many different things. Medically, medicine, you have things like peptic ulcer disease, you've got um, gastroesophageal varices, um, and you've got cirrhosis, you've got CKD, etc. Then for surgery, you have things like um, hemorrhoids, bleeding through hemorrhoids, and various different causes. Just think on the fly. And for psychiatry, you've got things like eating disorders, etc. For obstetrics and gynecology, you have menorrhagia, increased blood loss can cause anemia as well. So most of the time, if you just think about it through this sort of a uh, category such as this, then it's easy for you to cover all bases, and it's very important for a GP to think about everything. Then you have medications. Think about whether this patient has been having lots of NSAIDs, which can cause peptic ulcer and bleeding as a result. Think about whether they're on any anticoagulants that can increase the chances of them developing bleeding. Then allergies, not much to actually think about here. Then you have social. You can think about stuff like whether they drink alcohol, whether they have lead in the diet. Probably that comes in common sense or social. And then you go to family, think about conditions that have running in the family. Sometimes you can have thalassemia that runs in the family, etc. So as you can see, this way you can think about a problem in a holistic way and try and find out all the possible causes for the problem.